Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Ceftazidime. Its brand name is Fortaz. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only, and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action, or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Ceftazidime. We'll then touch on examples of dosing, and then finish it off with side effects. I've put together some slides to go over this information. Let's just jump right into it. So the first thing to discuss here would be the mechanism of action, or how this medication works. So Ceftazidime is a semi-synthetic, broad-spectrum, beta-lactam antibiotic. It inhibits enzymes responsible for cell wall synthesis. It is bactericidal against a wide range of gram-negative and gram-positive organisms. In terms of indications or reasons we prescribe this medication to a patient, we may see it used in the treatment of bacterial meningitis or bacterial sepsis. Patients with cystic fibrosis under certain conditions may use this medication, as well as patients who have an infection of the bone or infection of the skin or subcutaneous tissue. Infectious diseases of the abdomen may be treated with Ceftazidime, as well as severe respiratory tract infections and severe urinary tract infections. With respect to contraindications or reasons we would not be able to prescribe Ceftazidime to a patient, well, we wouldn't give this medication to a patient who had a hypersensitivity to Ceftazidime or to any other component of the formulation. As well, if a patient had a hypersensitivity to other cephalosporin antibiotics, they would also not use Ceftazidime. Now for some examples of dosing with Ceftazidime. So in the treatment of bacterial meningitis, we would typically see 2 grams given intravenously every 8 hours. In cystic fibrosis, under the setting of pneumonia due to Pseudomonas, we may see 30 to 50 milligrams per kilogram intravenously every 8 hours. The maximum dose would be 6 grams per day. In some female genital infections, we may see again 2 grams intravenously every 8 hours. As with all medications, there are some side effects or adverse reactions that patients may experience while using Ceftazidime. We'll go over a couple of those here now. Some common side effects may be an injection site inflammation. That happens 1.5% of the time. Phlebitis, or inflammation of the vein, may happen 1.5% of the time as well. And some patients may experience diarrhea 1.3% of the time. Some more serious side effects may be Stevens-Johnson syndrome, toxic epidermal necrolysis, Clostridium difficile colitis, anaphylaxis, or a seizure. Alright everybody, that's all we're going to talk about today with Ceftazidime, or Fortaz. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, most importantly subscribe to the YouTube channel. There's also some links in the description you can check out as well. And for today, take care.